Kegels may be harmful to your pelvic health, and in this video I am going to tell you why. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist, and I am dealing with pelvic floor issues a lot in my daily practice. What you have to understand about the pelvic floor is that it is a whole bunch of muscles of different sizes which work together as a team. That makes pelvic floor function very complicated and hard to understand. But in fact, the pelvic floor has to perform opposing tasks. Sometimes it has to relax, sometimes it has to contract. It is the center of coordination between the upper and the lower body. It is connected to the diaphragm, so there is a link to breathing as well. It serves us in urination and defecation, and it is important for sexual function in both men and women. Maybe that's the reason many men ask for Kegel exercises, to have better erections. But would they be effective? The answer is yes, if the pelvic floor is weak. If you have watched videos from my channel, and especially this one, you know that I routinely examine the pelvic floor in many of my patients. And there are actually two lessons I learned from all of these exams. Lesson 1, many men have a hard time to contract the pelvic floor because they don't know how and are doing it wrong. Lesson 2, very few men actually have a weak pelvic floor. On the contrary, there are more men with a tight pelvic floor. Some are so overactive, I have a hard time to perform erectile ultrasound because the sphincter muscle is as elastic as concrete. What are possible signs of a tight, overactive pelvic floor? Pain in the genitals, pain in the perineal area, pain in the tip of the urethra, a burning sensation in the urethra when urinating, and sometimes even without urinating, a burning sensation after ejaculation, erectile dysfunction, urinary urgency, daytime variations, typically no problem at night and in the morning hours, certain movements which may increase the problems, and so on. So what do you think will happen if you perform Kegel exercises on an overactive pelvic floor? Let's use an analogy to the neck and shoulders, because most of you know what it is like to be tight there. Imagine you have a tight neck, and in order to loosen up, you don't go for a massage, but grab your dumbbells and do presses. What do you think will happen? Your muscles will get even tighter. You have just worsened your problem. The same goes for the pelvic floor with Kegel exercises. What you would need to do with a tight pelvic floor is exercises which train the muscles to regain their original length and restore muscle function. Kegels will tighten and shorten them even more, resulting in more pain and more problems. If your pelvic floor is weak, however, Kegel exercises might be exactly the thing you need. The other thing is technique. My observation here is consistent with the literature, showing that indeed many people have no clue how to contract the pelvic floor. Many try by contracting their buttocks or abs, but that's not how to do it. If you do it right, there is a squeezing and lifting action going on, and there is no whatsoever activity in the buttocks or abdomen. So if you want to do something for your pelvic floor, my advice is to be cautious to start anything on your own, because you may make things worse. Since it is complicated, the best way is to get a proper assessment and guidance by a pelvic floor therapist. Some of you will be surprised to find out that they don't need to strengthen their pelvic floor any further, but learn how to relax that area. Thanks for watching. Bye-bye.